ECON 215, Introduction to the Economy of Ghana. In this session, we would pay attention to Ghana's health sector. So we would look at the issue of health in Ghana. The first topic we would treat would be health and economic development. What are the interconnections between health as well as economic development? And then two, we will have a look at Ghana's health sector, look at its structure, the trends in the health sector, and some indicators. And then we would end with the policy interventions. So let's have a look at the session overview. Here we're saying that healthy people makes a wealthy nation. So in this section, we would pay attention to the role of health in the development, as well as look at the health sector in Ghana and some policy interventions as well. So yes, we would have a look at three key areas. One, the interconnection between health and economic development. We will have a look at the Ghana's health sector, and then again we would end with some policy intervention. For the reading list, you may refer to the Sakai platform, where we have some materials for you. So let's have a look at health and economic development. Health and economic. There are many benefits of health to any nation, okay? And this, we can link it to what we did in section 12, looking at yes, health or good health would lead to what is called improved productivity. So what happens is that if you are well, you can work, and therefore you can increase your productivity. In other words, your output per capita, or your output per worker. The other is the improved learning aspect of it. So once you have an improved nutrition, and what happens is that it will lead to reduced disease, and this would lead to an improved cognitive development, and will therefore enhance your ability to learn in this case. And then once you also have good health, it may lead to reduced family size in this case. Okay. And then there's also that link or that interconnectivity between health and that of what? Investment. So people who are healthy would often have the ability and the incentive to save more, and in this case it will lead to the accumulation of what? Capital, and may help them fuel growth through other investments. There's also the increased availability of land for productive use in this case. And then the other benefit of health has to do with reduced treatment burden. So again, what are the characteristics of the health system or the health sector in many developing countries? How does the health system look like? In most developing countries, we would find fewer health facilities compared to the developed countries. And in most cases, these health facilities are in a deplorable or very poor state. In many developing countries, you will also find a very high patient-doctor and a high patient-nurse ratio as well. And then also in many developing countries, we would find a low life expectancy. This is relative to the developed countries. And then in many developing countries, we would find that many of the private health facilities are few, and these are located mainly in the urban areas. There is also loads, there is also often a lot of congestion at health facilities, especially the public ones. Now let's have a look at Ghana's health sector. The first indicator we would have a look at is Ghana's doctor density. Ghana's doctor density. Ghana's doctor density actually measures the number of doctors per a population of 1,000 people, and it's far from ideal in the case of Ghana, but worse than even the sub-Saharan average density for the doctor density. In 2014, the doctor density situation worsened when compared with the 2013 density of 0.090 in 2014, compared with 0.1003 in 2010. So yes, from 2013 to 2014, we are saying that there has been a drop in Ghana's doctor density, or in the doctor density from Ghana. The slide you will see would give you the trend in terms of the doctor density for Ghana over, I think it's from 2010 to 2013 across the regions we have in Ghana. You can actually look at these, trend your self, and then attempt to analyze it. The other very important indicator has to do with the MMR, which is the maternal mortality rate. What has been its trend over time? The maternal mortality rate has actually decreased from 154 deaths per 100,000 live births in 2014 by approximately 8% in this case. Let me say that although there has been a fall of about 8% for the MMR for Ghana, Ghana's total MMR is much lower than the sub-Saharan average, which is about 510, and it lags behind the lower middle income country average of about 240. Let's have a look at other health statistics or other health indicators that will help us to understand the health sector in Ghana. Let's have a look at issues of antenatal care coverage, supervise the leverage, and the proportion of pregnant women who are receiving at least 2 doses of tetanus toxoid vaccine has actually deteriorated in 2014 compared to the 2013 figure. And if you compare all these indicators to the targets, we can say that yes, indicators like post-natal care coverage, that of family planning, and then the others have missed their targets or missed their target during the year under review. So here on the slide, you can see some of the selected health indicators and their trends over the years. So you would have a health indicator as against the trend over the years. You can take your time and then have a look at it and see how best you can analyze it. Now let's have our policy intervention. And as I keep saying, these are derived from the development policy frameworks that Ghana have actually implemented over the years, so they are not that new. One key policy intervention has to do with how to ensure the reduction of new HIV and AIDS/STIs And then also the issue of what? Infections, especially among the vulnerable people. So there are many policy, what do you call it, interventions in this regard. As I said, there are many policy interventions in this case, and there are many of them. Another policy intervention has to do with how to improve HIV and AIDS, STI cases, management. So this has to do with how best we can actually manage cases that has to do with HIV and AIDS, as well as other STIs. And there are many policy options that seek to do this. The third policy option has to do with the improvement of institutional as well as financial capacity for efficient and effective delivery of HIV/AIDS and then the STI services. So yes, there is also a policy intervention that seems to address how we can effectively manage HIV/AIDS and STI, services as well as its cases. The references for this sessions are actually available on your Sakai platform. Therefore, you can go for it. So this is the end for this a particular session and the end of the entire ECON 215, and I wish you all the best.